social services, went from one agency with a very long name to another agency with a very long name, but very, very important. Now I do want to give the floor to our acting director, Dr. Cooper Nurse from the Guam Behavioral Health and Wellness Center for his remarks.
Heartening to see everyone come out today despite the but I promise I'll keep my remarks short and as intended. This month is May Mental Health Month. Weird, it's the month of May, and we're celebrating mental health on May Mental Health Month. This is actually a celebration that started about 80 years ago in the 1940s, and it's something that was put out as a means to generate awareness, and create a space for mental health, mental wellness, and talk about prevention. And so this month, as part of our efforts in organizing activities to celebrate this year, the theme for May Mental Health Month is Open Minds, Open Doors. So what this is really about, it's about encouraging more honest conversations around mental health. And that, I'm sure, as many of you can attest, is something that can take place really anywhere. It's not just in doctors' clinics. It's not just in Guam Behavioral Health or any of our partner agencies. It's at home. It's at school. It's with coworkers, right? It's about having these open, honest conversations to be able to break some of the stigma that's been surrounding mental health, at least for the last 80 years. So what I'll just quickly jump into is just to kind of go down the line of all the different activities that we have planned for the month. The first, of course, being today, sort of our kickoff celebration with today's proclamation signing. And then next week on May 8th, we'll have our Children's Jamboree, again, celebrating Children's Mental Health Awareness Day. This is happening next Thursday at Skinner's Plaza from 4:30 to 7 p.m. It's a free family event. Bring your family, bring your friends. We'll have games, we'll have activities, and of course, we'll have mental health resources available for you all to join and understand and ask questions for. We'll be celebrating Mental Health Action Day. This is really joining a national call to take at least 1 hour of your day to do something that supports your mental health. And as mentioned, thank you, Acting Governor, for supporting this effort through administrative leave so that folks can celebrate this. We did get the memo. The following week on May 24th, it's a Saturday, 10 a.m. to 3 p.m. Guam Behavioral Health will be out in force at the Gani Shopping Center. And this is, again, another free activity for the public. Please come, please meet our staff. We'll have all of our program staff there so that they'll be able to answer questions. You'll get to meet the service providers that are providing some much necessary mental health services to our community. But that's not all. We also have a variety of trainings throughout the month. And all of these trainings are free and open to the community. So on May 9th and again on May 22nd, we'll be facilitating youth mental health first aid. This is a training that's specifically geared towards talking about the impacts of mental health with youth. We'll also on May 16th be conducting the Pacific Way to Wellness. This is a newer training for us, and this is specific to mental health, relates to growing up here on the island, growing up in the Pacific. So more catered to what we experience locally. May 20th, Safe Talk is a suicide prevention training, and that's happening May 20th from 8 a.m. to 12 p.m. And then Resilience and Thriving, the Secret Power of Stress. This is a stress management, burnout reduction type of training, and that's happening on May 30th. We also have our social media presence. So our team has been hard at work organizing and developing content, both digital and physical. Show you, these are real things, and I'll talk a little bit about this throughout the month of May. So throughout the month, we'll have our team will be posting daily posts on Instagram, Facebook, and then we'll also have some YouTube content out there. Just daily posts and resources shared throughout the month of May on opening up these conversations and again breaking the stigma. This is a card game that you can actually download through our social media, and it's got our Open Minds, Open Doors theme, and this card game actually provides you with several conversation prompts. So this is something that you can play at home with your friends, with your family. You can kind of look through these questions and answer these yourselves. These are questions like, what have you been most sensitive to lately? What insecurity have you been holding back the most? So these are meant to really open up these conversations and have this be a more comfortable way through a game of engaging in these types of interactions. And then lastly, we'll also be showcasing our Open Doors video series on our social media sites. This is again a way for us to talk more specifically about each of the programs, behavioral health, and how each of these programs helps the community in various ways. So, come join our activities, join a free training, download the card game. This is really fun. Um, engage with social media. Really, what we want to do is ensure that we're continuing to push the narrative. Mental health is health. These are concerns that have been stigmatized for years, and really, this is about your health, your well-being, and so this is a piece that everyone has talking about this matters. Support is always available, and as always, we're always here and available to support. You can contact us at 988. That's our crisis lifeline. If you have specific questions about our activities, you can also reach us at communications@gbhwc.guam.gov. Thank you.
Wait, stand by, ma'am. May I give you a microphone?
Okay, hi. Is this on? Type. Okay. We are Children's Division, CASD, and we want to bring this image to everyone about mental health wellness because it starts with our children and it starts with our family and also it starts with everyone in our community. It takes a village to raise our children. And we got fantastic children. They're creative, they're talented, they're musical. And so we want to see a lot more of children happy. We want to see a lot more children playing. And on that note, that's what Cassidy's intentions are, because we're a system of care, because we believe that it's nobody's fault. Sometimes we're just dealt with what we're given, and we promote the support of families, children, and their natural support, as well as everyone here who's here and everyone who's not here will remember them as well. But anyways, this is just something visual to keep in mind about how important children's mental health or adult mental health resonates to make this island an awesome island. Okay, so I'm a visual learner, so that's why I had to bring this. So anyways, take it away. Who gets the mic?
Thank you so much. I'm a visual learner myself, so I'm very appreciative of the visual arts that you're bringing here. Yes, please leave it here and we can just keep it on display. We are live streaming this event on Governor's. Thank you so much to our acting director from Jibwig for those remarks and for sharing with us what the month's activities will include. He said open minds, open doors, quite literally. We are opening the doors here at the Office of the Governor and therefore supporting our mental health and awareness. I do now want to give the floor to the Honorable Joshua Tenori, our acting Governor of Guam.
Thank you and welcome and happy Friday. I just also want to welcome Judge Barcinas, who was my former boss at a different time, and thank him actually because during the time that we worked together, we had a chance to work collectively together, really focused on children, on juveniles, on their services, but also on mental health. And in fact, we have a continuing partnership with the judiciary amongst the different agencies of the government, but recently, really trying to address an area that needs a lot more help and assistance. We have a large number of folks on the island that are suffering from mental health. They have a diagnosis. Many of them need to be medicated, and sometimes, as the professionals here know, sometimes medicines don't make people feel that right. Maybe they don't want to take them, and then there's a challenge to their stability. There's also a challenge to their own security and the security of others. And so we are working now collectively to address a pathway to introduce and effectuate a concept called assistive outpatient treatment. And in this regard, we look at consumers on the island that may have received mental health services, maybe have a diagnosis, also maybe been involved in the criminal justice system, and helping families and first responders find pathways to stabilize people. Lately, I've been having an opportunity to hear from police officers, and I had a discussion about this yesterday. And some frustrations are, they may family members may call for some help, and we have a feature in our statute that allows a 72-hour hold, and people get stabilized, but when they get released, they immediately become unstable. And it becomes this vicious cycle. Providers at behavioral health, there's some rules and methods that they need to address, and nobody feels satisfied. And so we're working with Judge Barcinas as the lead for the judiciary, and with our leadership to try and find a pathway to effectuate a change that is going to help people and save lives. I think most of us, or as many of us, know people in our community that we lost because of a mental health crisis. In fact, lost to suicide. And so this is one of the ways I feel that we'll be able to try and really make some movement on that. I always also like to focus on what we can do for children, because as we know, the more stability and services we provide children at the youngest of ages, the more they may be empowered to lead fuller lives. And in this regard, I do want to say that I'm so grateful that Guam Behavioral Health has been focusing on juvenile services. That has been an area sometimes that's been sort of off the table. There was a period of time where our agency was under a federal receivership, and the focus and resources were in other areas. And other partners had to step up, including the judiciary, that played roles in getting clinicians to be able to serve juveniles when they were underserved elsewhere. So the system of care and providing opportunities to strengthen the relationships with the Guam Department of Education and youth serving agencies such as the Department of Youth Affairs. In this case, in those areas, we're working to close the gap and really provide services more sooner than what we're seeing today. So what I see is that we continue to make improvements in the system, but that also means we should take the time to recognize the remarkable achievements and progress that the staff of the Behavioral Health Agency and their partners have made. That's not this. A lot of this is leadership of former director Teresa Ariola and the current director Carissa Pangilinan and our great deputy James Coupeners. We moved from an agency ownership to an accredited organization. And if I'm hearing things correctly, it's such an awesome to know that the reaccreditation has been approved and the paperwork is being done, but yet another mark in the success of Guam Behavioral Health and Wellness Authority. That is a great progress. Um, the island, of course, also made some changes, right? We and the attention we're bringing to mental health services today is continuing that. You know, we did have to change, and people don't like change. We had to change what we did in even calling each other. We have to use the 671, right? And that was because we made a commitment to activate 988 on the island and be part of that national network. That is a big change and a big improvement because we know that folks that are in crisis, especially if they're isolated, the success rate is challenging with them. And having a crisis hotline, having 988 in a national and access to the national pathway helps us save lives. I also want to recognize that some of the innovations. I know that we have a crisis response team. And recently, Guam Police Department was one of the agencies, I think Guam Fire also, signing an MOU to try and expand the folks and assistance that we have. Many times when we have a disturbance in the house, maybe the answer isn't going to be a criminal case. It should be dealt with as a medical emergency and figure out pathways to provide that care. And this is one of the reforms that Judge Barcinas has been leading also at the court with the mental health court and trying to expand a civil docket away from a criminal docket. And of course, on the criminal justice side, we also know that a large percentage of our adults and juveniles that are in the criminal and juvenile justice systems have mental health diagnoses and are medicated. That is also a leading indicator about the path work or the path in front of us. So today we ask the public, the people of Guam, to take special attention to the cause of mental health awareness. We also look for pathways to improve the services that we have for our youth, for our juveniles. We also remember all of the things in our future that we have to work towards. Expansive drug and alcohol treatment, residential housing options, respite care for families that are caring for loved ones, and all in all, making sure that people are able to see a mental health professional and get a proper diagnosis and a treatment plan. These are all essential elements in what we see as an improved quality of life for the people. So today, Dr. Kupeners, congratulations for your part in leading this agency. Therese, thank you for your leadership. I know what you don't know, every 2 weeks we have a human services touch and go with DISID, DYH, public health, homelessness, behavioral health, and in that space, we're constantly trying to improve areas that require improvement. I think that it's always very wise to recognize where we feel things are and where we know things need to be, because the truth is, our current status quo, as much work as we have done, is not what we are aspiring to. We recognize the progress, but we know we need to do better. That is the one way that we can do better, is to know that we do need better because our people need better. And so congratulations, and Biba Mental Health Awareness Day and Children's Mental Health Day, Awareness Day, and Mental Health and Wellness Month. Masi.
Viva. Thank you so much, Acting Governor. Now for the reading of the proclamation, our reader today is Mr. Brandon Holmes, social marketer for the Guam Behavioral Health and Wellness Center.
Proclamation number 2025-47, a proclamation of the governor proclaiming May 2025 as Mental Health and Wellness Month, May 8, 2025 as Children's Mental Health Awareness Day, and May 15, 2025 as Mental Health Action Day. Whereas mental illnesses are common and treatable, worldwide reports indicate that 1 in every 5 people suffers from a mental illness throughout their life, with the potential for mental health disorders to start as early as childhood. Whereas mental health is a key component of a person's overall health and well-being, therefore addressing the complex mental health needs of children, adults, and families today is of fundamental to the future to the future of our island. Whereas mental health conditions are real, but with effective treatment, individuals with mental health conditions can lead full, productive lives. Whereas the stigma surrounding mental illness is one of the main factors inhibiting people from seeking mental health care. Whereas there is substantial research that self care through humor, spirituality, recreation, social connections, and work life balance can help individuals protect their mental health and well being. Whereas each business, school, government agency, healthcare provider, organization, and citizen has a responsibility to promote mental wellness and support prevention efforts. Whereas the Guam Behavioral Health and Wellness Center, or GBWIC, partners with nonprofit organizations, community and faith based programs, support groups, advocates, private practice doctors, and other professionals on Guam who also work to combat the stigma of mental illness, provide needed mentorship services and support, and strengthen the mental health and well being of children and adults in our island community. Whereas the theme for Mental Health Month 2025, Open Minds, Open Doors, reflects GBWIC's commitment to breaking stigma, fostering positive attitudes towards mental health, and encouraging individuals to seek help when needed. Whereas May 8, 2025 is recognized as Children's Mental Health Awareness Day, highlighting the importance of supporting children's mental health and reinforcing that positive mental health is essential for health development. Whereas May 15, 2025 is recognized as Mental Health Action Day, encouraging everyone to dedicate 1 hour out of their day to prioritize their mental health, connect with themselves and their communities, and take action to support well being. Whereas suicide remains a serious public health concern in Guam, with 31 deaths reported in 2023 and an age adjusted rate of 23.9 per 100,000, well above the U.S. average, disproportionately affecting individuals aged 20 to 29 and 40 to 49, with Chamorros and Chukis experiencing the highest rates. Whereas GBWIC continues to expand and diversify access to early intervention and life-saving resources through the 988 Suicide and Crisis Lifeline, mobile crisis response, and other critical support services, resulting in over 25,000 calls, 200 activations, and 4,400 clinical intakes from individuals seeking support since 2022, underscoring the ongoing demand for accessible mental health care in our community. Whereas the partnership between the Judiciary of Guam and GBWIC strengthens the island's capacity to respond to individuals experiencing mental health crises. Whereas in 2008, the Judiciary and GBWIC collaborated in the development of the Mental Health Court, or MHC, which is a specialized docket for persons with serious mental illnesses, with or without co-occurring substance use disorders, who become involved with the Guam criminal justice system and whose goal is to decrease the number of persons with SMI or MHSUD from entering the criminal justice system through access to effective community-based crisis services. And whereas all citizens, government agencies, public and private institutions, businesses, and schools across the island are encouraged to promote mental health awareness, support prevention efforts, and advocate for accessible services for individuals experiencing mental health challenges.
Now, therefore, I, Joshua F. Tenorio, Octu Magetlahin Guahan, Acting Governor of Guam, by virtue of the authority vested in me by the Organic Act of Guam as amended, do hereby proclaim May 2025 as Mental Health Month, May 8th, 2025 as Children's Mental Health Awareness Day, and May 15th, 2025 as Mental Health Action Day. I further cause the Great Seal of Guam to be affixed here in the village of Hagåtña on the second day of May in the year of our Lord on the Domini 2025, and Viva Mental Health and Wellness Month.
Thank you so much, Brandon, and thank you so much to our acting governor. I'm actually going to ask that everyone else stay in place, but acting governor and acting director, if you could turn around, we're going to do the photo reversed, a group photo, so stay where you are. Photographers will come to the front.